Hello, my name is Kira McDuff, and I am the primary author on this research report, Priorities for Research, Education, Clinical Practice, and Policy from the Long COVID Physio International Forum. The purpose of this manuscript is to determine priorities in long COVID and rehabilitation. We sought the perspectives of consultants who registered for and attended the Long COVID Physio International Forum. This included people living with long COVID or other chronic conditions or disabilities, clinicians, service providers, educators, students, and trainees. First, I would like to share some background on Long COVID Physio as well as the forum. Long COVID Physio is an international peer support, education, and advocacy patient-led association of physiotherapists living with long COVID and their allies. The Long COVID Physio International Forum was held online in September 2022. This was in partnership with Rocky Mountain University of Health Professions and PhysioCamera. One of the main aims of the forum was to discuss priorities in long COVID and rehabilitation. As part of the forum, we conducted an international consultation on priorities for long COVID and rehabilitation. We collected feedback from people who registered for and who attended the forum. We used web-based questionnaires, the Zoom chat, and posts on an online platform called Padlet during the forum. Our team, which included people living with long COVID, analyzed the data using group-based content analytical techniques. There were 794 consultants, of which 47% were living with long COVID. We also had representation from 34 countries. 17 priorities for long COVID were identified, spanning 4 categories, which were research, education, clinical practice, and policy. Priorities were focused on long COVID and rehabilitation, but some did expand beyond the scope of rehabilitation. For example, there were priorities pertaining to pharmacological interventions. Research priorities spanned epidemiology, socioeconomics, pathophysiology, characterizing disability, health equity, establishing diagnostic criteria, and intervention studies. Education priorities were identified for people living with long COVID, for employers, policymakers, and healthcare professional students. Clinical practice priorities included safety and person-centered approaches. Finally, policy priorities included accessibility of care, supports for people living with long COVID and their caregivers, and public health messaging. The 4 priority areas are not mutually exclusive, and in most instances, addressing gaps in long COVID and rehabilitation will require a unified consideration of clinical practice, education, research, and policy priorities. For example, addressing gaps in access to rehabilitation for people living with long COVID will require a coordinated approach across the 4 areas. One of the clinical practice priorities was to use safe approaches to long COVID rehabilitation. There are already guidelines, such as the World Health Organization Clinical Management of COVID-19 Living Guideline, about what constitutes safe and effective approaches to long COVID rehabilitation. Specifically, safe long COVID rehabilitation should include personalized approaches, incorporate virtual care, and focus on symptom reduction and energy management techniques. However, we know that many people living with long COVID continue to experience negative outcomes, particularly symptom exacerbation, following rehabilitation that's focused on progressive exercise. Also, research exploring the knowledge and experiences of rehabilitation providers suggests that not all providers possess an in-depth understanding of existing guidelines and recommendations for long COVID rehabilitation. Therefore, to support the clinical practice priority to use safe approaches to long COVID rehabilitation, it is essential to address the research priority to identify and to evaluate safe management strategies for long COVID, and also to address the education priority to disseminate this knowledge to both current and future healthcare professionals. The priorities that we identified will play an important role in guiding research, clinical practice, education, and policy to advance health outcomes for people living with long COVID. Thank you for watching and for your interest in our research report.